it's Ashley from Demystifying Your Health. I'm so glad that you're here. Today we're going to be talking about over-the-counter medicines. Sure, if you're not feeling well and you go to the doctor, you expect to get a prescription to take to the pharmacy to get the medicine you need to feel better. But what if there are certain conditions you don't even need to go to the doctor to get that piece of paper, but you could just go to the pharmacy and get the medicine you need instead? What are these conditions? Which medicines do you need? And how do you use them safely? Let's find out. Over-the-counter medicines are non-prescription medications. This means you do not need a prescription from your doctor to purchase them. They are considered to be safe and effective as long as you follow the directions that are on the label. And this is one of the key considerations regarding safety. There's a few other considerations which we'll talk about in just a little bit. There are many different types, depending on what your symptoms are. So let's take a closer look at the symptoms and then what medications treat those. There are several different things that you'd probably need medicine for. One of them is a fever. There's a couple of options for this. You can take acetaminophen, which is Tylenol, or ibuprofen, which is Motrin or Advil. Both of these come in children's forms, which is usually like an oral liquid solution. So if your child has a fever, you're able to give them this as well. Just follow the directions on the child dosing so that way you make sure you don't overdose them. As far as pain goes, acetaminophen and ibuprofen also work for this as well, so this is great. There's a third option though, which is naproxen, otherwise known as Aleve. It's important to note that both ibuprofen and naproxen are NSAIDs, which is a non-steroidal anti-inflammatory drug. While these drugs are great, they can increase your chances of bleeding or kidney disease. So if you have risk factors for these, check with your doctor before taking them. The third medicine we're going to be looking at, or third category for medicines, is for coughing, which is guanfacine, which is the brand name is Mucinex, or dexamethasone, which is Robitussin or Vicks 44. Mucinex is designed to decrease the amount of mucus your body's producing, whether it's in your nose, your lungs, wherever it is. It's supposed to help dry you up. Whereas Robitussin is more of a cough suppressant. So while they both will help with a cough, they work on different functions in the body. So you can actually take them at the same time. In fact, some medicines include both of them in the same medicine, so you only have to take one pill, which is nice. The next group of medicines we're going to be looking at are decongestants, which actually come in two forms. Comes in oral or pill form, and then nasal spray form. So as far as pills go, you have pseudoephedrine, which is Sudafed, and phenylephrine, which is Sudafed PE. The main differences between these two is that Sudafed, the plain version, has usually some form of stimulant in it, versus Sudafed PE does not. When it comes to nasal decongestants, you have oxymetazoline, which is of Afrin or Sinex, and phenylephrine again, but in the form of neosynephrine. And the key thing to remember with these nasal decongestants is that if you use them longer than 3 to 5 days, you can actually have rebound symptoms. And what this means is your symptoms actually come back worse than they were before. This is why it's key to follow the directions that are on the labels when it comes to using them. The next group is a big group. It's for allergies. Obviously, a lot of people have allergies throughout the year, but especially during the springtime. The good news is there are plenty of medicines to help with this. So you have dihydramine, which is Benadryl. You have chlorphenihydramine, which is chlorotriamptin. Brompheniramine, which is Dimetapp. And then clemastine, which is Tavist. It's important to note that these four can actually cause drowsiness. So try not to use these if you know you're going to be driving a car, operating heavy machinery, doing anything that requires you to be awake and alert. Most often, it's recommended to take these at nighttime so that way you don't have this drowsiness effect during the day. If you do need to take something during the day, there are options, such as Lortridine, which is Claritin or Alibert, phenophenidine, which is Allegra, and then Sertrazine, which is Zyrtec. Another big group of medicines that people often need are antacids. And there's plenty of options in this group. You have Ranitidine, which is Zantac. You have Cimetidine, which is Tagamet. You have calcium carbonate combined with magnesium hydroxide, otherwise known as Rolaids, a little easier to remember. You have magnesium hydroxide aluminum hydroxide and smithicone, which is otherwise called Malox. You have aluminum hydroxide or with magnesium carbonate, which is known as Gaviscon. And you have bismuth subsilicate. Sorry about that. Bismuth subsilicate, which is Pepto-Bismol or kaopectate. When it comes to having nausea or vomiting, there are a couple options here as well. Usually it's just best to let your body run its course and make sure you're drinking plenty of fluids. However, you can try bismuth subsilate, which is Pepto-Bismol kaopectate, Emitrol or Malox total stomach relief, and then it's important to have some form of replacement liquids, such as Infolite or Pedialyte, especially for children if they're vomiting a lot. You want to replace not only the fluid that they're losing, but also the electrolytes that they're losing through the vomiting. Besides having an upset stomach where you have indigestion and nausea and vomiting, your stomach can be upset in other ways as well, such as having diarrhea. The good news is there's also medicines to treat this. So you have loperamide, which is Imodium, and it works really well. Just be warned that if your diarrhea is caused by an infection, it can actually make your diarrhea worse if you take Imodium. You have bismuth subsilate, which is Pepto-Bismol and kaopectate. Once again, it works well for diarrhea as much as it does for any of the other symptoms that we've already talked about. And then Infolite, which is Pedialyte, which same thing with the nausea vomiting, you're wanting to replace those fluids and electrolytes that your body's losing through the diarrhea. Another common stomach complaint is gas, where you feel that bloated, tight feeling, you're burping, all sorts of stuff, you just don't feel good in there. So you've got smithicone, which is Gas-X, and then you have bismuth subsilate or Pepto-Bismol kaopectate. Again, once again, it works really well. And then another problem, which is common and completely opposite of diarrhea, is constipation. So for this, you have docusate sodium, which is a stool softener to help make it so your stool is less hard, therefore easier to pass. Or you have Biscadol, which is Ducalox, which is a form of a laxative. And another laxative is magnesium citrate, which usually comes in a liquid form that you actually drink like a bottle of. It works incredibly fast. We used to prescribe it all the time in the ER for people who were having trouble with constipation. There are several other conditions that you might need medicine for. One of them is motion sickness, which you could take diaminohydronate, which is Dramamine, or meclizine, which is Antivert, C-Legs, or Bonnie. Usually either one of those groups works really well. If you have a rash or itching, you could try hydrocortisone cream, which is known as cortisone 10 or Cortade. If you have a migraine, you could try, it's a combination medicine, so it combines aspirin, acetaminophen, and caffeine all in the same capsule, and that's known as Excedrin. If you have mouth pain, like you bit the inside of your mouth and it's sore, you could try benzocaine, which comes in the form of Oragel. And for infection prevention, like you got a cut on your arm, your leg, somewhere, and you want to prevent it from getting infected, you can try a cream that contains bacitracin, neomycin, and polymyxin B, which is known as Neosporin Triple Antibiotic Ointment. All right, when it comes to the last two groups we're going to talk about, first you have for period cramping. And similar to migraine medicine, it's a combination medicine, so therefore there's several things in one pill. In this form you have acetaminophen, caffeine, and pyrolamine maleate, which the brand name is Midol. Next group is diaper rash, athlete's foot, jock itch, thrush, ringworm, and yeast infections. All of these are fungal infections. So depending on where your infection is, you'll need a different kind of treatment. Your pharmacist can help guide you if you're unsure of what you should buy. But some general overall medicines within this group are nystatin, which is also called mycostatin, Nimacin, Nystop, or Pediadry, miconazole, which is Monostat or Desinex, cletramazole, which is Desinex or Lotrimin, ketanazole, which is Nizolol or Extina, and phenazopyendrine hydrochloride, which is Azo. There are several things that you need to consider before you take any medicine, let alone an over-the-counter medicine. The most important thing that you could possibly do is always read the label first. And this is key for several reasons, because there's a lot of information on there that you need to know, such as the active ingredients, the use of the medicine, any warnings about the medicine, the purpose of the medicine, directions on how to use the medicine, what the inactive ingredients are, the expiration date, the lot and batch code, which is key if there's a recall on a medicine, you need to know this, and what to do if an overdose occurs. You can use the acronym SAFER, which means speak up, ask questions, find the facts, evaluate your choices, and read the label. This is key because if you are taking any medicine at home already, whether it's prescription or over the counter, it can have certain active ingredients. So if you go to the pharmacy and get another medicine and you don't know that it has the same active ingredients and you take both medicines, you can end up having an accidental overdose, which is not something that you obviously want. And this is also why it's important to talk to your pharmacist or doctor if you're taking prescription medicine on a regular basis or starting a new medicine and you're also taking over-the-counter medicine, because they can have interactions, some of them adverse reactions, to each other, and this could obviously cause significant problems. Some other key considerations when taking over-the-counter medicine are very important to know, such as alcohol. Alcohol, obviously, is a depressant of your central nervous system. So if you're taking medicine to help you sleep, that you take over-the-counter or prescription, it can actually interfere with this and cause you to stop breathing. And alcohol also interferes with the effectiveness of certain other medications. So this is why when you're on medicine, don't drink alcohol unless it's been okayed by your doctor. Another big thing is don't take laxatives if you have an upset stomach, such as nausea, vomiting, diarrhea, anything along those lines, because obviously this is only going to make those symptoms worse. If you're pregnant or breastfeeding, the rules regarding over-the-counter medicine, prescription medicine are completely different from that of a person who is not. So before taking anything over-the-counter, definitely check with your primary doctor or your OBGYN or your pharmacist. And then another big concern is with sedatives and tranquilizers, particularly if you're taking prescription forms of these and you take anything over the counter, it can actually either inhibit this and you have issues with being able to sleep, or they can compound the effect and make you even more drowsy and sleepy and all of those symptoms that come with it. This is why you want to make sure before you take anything that potentially could interact with any medicine, always check with your doctor or pharmacist. Obviously, when you're not feeling good, you want to have the medicine you need on hand in the moment. If you need to run out to the pharmacy to get it, then you will, but it's usually better to have something so that way it's readily available. So this means that you need to store over-the-counter medicines. So there's a couple of things to remember. One is to store it in a cool, dry place, or as directed on the label. Two is to throw away any medicine that's past expiration. While most medicines do not become toxic after expiration, they actually become less effective, it's still not a good idea to risk this. So best practice is to go through your medicine cabinet at least once a year, find anything that's expired, throw it away, and then replace it with a new product. That way you have it. And then the last and most important thing here is to keep your medicine in the original containers, because then this way you and anyone else knows what that medicine is, and you or no one else will get confused as far as if you need something, you take it and it's not the right thing, then obviously you can end up overdosed, you can end up with a bunch of different problems along those lines. When it comes to over-the-counter medicines, there's one last thing that we must talk about, and that's children. Children are not little small adults. They're their own unique person, literally. And when it comes to doses, it's based off the child's weight. This is why you don't ever want to give a child an adult medicine, even if it's a smaller dose, because it can be over the amount that the child should receive and you can accidentally overdose them. It's important to know the different abbreviations when talking about dosing medicine for children, such as TBSP, which is for tablespoon, versus TSP, which is teaspoon. Milligrams is mg, milliliters is ml, and ounces is oz. When measuring medicine for a child, always use the measurement that is listed on the label. If it says tablespoons, use tablespoons. If it says ounces, use ounces. Don't ever substitute or try to calculate something different, because this is where mistakes can happen. Always consult with a medical professional before giving more than one medicine at a time to a child, because they can interact. The doses could be wrong for weight, and there's a lot going on. It's better to be safe than sorry in this regard. And the last thing is keeping child safety caps on all medicines, whether they're for kids or adults, and keep all medicines out of the reach of children. This is important so that way they don't accidentally get into them, because obviously children love to explore. Over-the-counter medicines are extremely helpful. And now you know sort of what to look for if you need something for any particular symptom that you're having. If you have any questions at any point, always talk to your pharmacist or your doctor. They'll be happy to help you. Thank you for joining me today, and stay healthy.